All right, so now, oh, now wait a minute. All right, so now we're talking about like I said, somebody asked a question before we log out. If you have a 4-bedroom flat, it makes your work easier. It makes your work easier in the sense that you can have one room for a man, if you have one room for a female, and you will have extra one room. That extra one room, you can admit pediatrics patients in there. All right. So now let's talk about the maternity home. The maternity home. For maternity home, the difference is just that the maternity home does not have this type of health facility. Is established by a registered midwife only, just for women, children below 18 years, pregnant women, for taking delivery, and nursing mothers. Some have added family planning to the list of their services, although it is still legal, but surgery cannot be done in a maternity home. This type of healthcare facility is managed and operated by a registered midwife with the Nursing and Midwifery Council of Nigeria. What this means is that you can't do a surgery in a nursing home, okay? You can't have a surgery in a nursing home. You can only take delivery, repair minor cases, but you can't do a surgery. For surgical cases, you have to refer out, okay? You have to refer out. And you can, as a midwife, you can practice alone. But if you are not a midwife, you can always employ one. Yes, you can always employ one. The requirement is the same as hospital. What are the requirements? The requirement is the same as what? Hospital. Let's review the requirement again. Number one, for a maternity home, you are not allowed to admit a male patient. They don't want to see a male patient above 18 in a maternity home. Are you hearing me? They don't want to see a male patient above 18. So all patients must be, if it is a male, it must be below 18, or it must be a female. The requirement is the same thing. It's the same thing, just that for a nursing home, you can use 2-bedroom flat because it's only female that you are expected to be admitting. So you can put children in one room while elderly people like women in the other room. You are allowed to have 2-bedroom flats. Okay, you're allowed to have 2-bedroom flats. All right. So the requirements are just the same. For the equipment, they are all the same. Okay, look at this part D. For the equipment, they are all the same. Why? You must have washing machine, hand washing machine, autoclave, medical waste management. You must have a generator, minimum staff. You don't need a doctor for the minimum staff area. You don't need a doctor, so this one is ruled out. This one is ruled out. So for minimum staff, instead of, okay, for minimum staff, you need a registered midwife, which is compulsory. This place that I just underlined. Can you see it? You need a registered midwife for the minimum staff in a maternity home. You need a registered midwife, while other requirement applies. All these ones is not compulsory, just like it's not compulsory in an hospital. Okay, then sorry. All right. So for a nursing home, is the maternity home clear? Is the maternity home clear?
Yes, it's clear.
The maternity home is clear to all of us, right? All right.
Yes.
Okay. Ruth, raise up. Ruth, ask your question.
Yes.
Ruth, go on, ask your question.
Okay, thank you.
Yeah.
About this maternity home, it has been my interest for a very long time.
Okay, go on.
And apart from being a registered midwife with the Nottingham Midwifery Council, is there another requirement that Nottingham Midwifery Council requires for a midwife to open a maternity home?
No. Once you are a registered midwife, then you will now need to register with your association, which is AGPNP.
I didn't get that.
The requirement for registering a maternity home, number one is just like the requirement for registering an hospital. Let me list it for you. The requirement. Number one, you need to have a business name. Do you understand that?
Yes.
Like
yes.
Ruth Maternity Center, which must be registered with CAC. I just taught you how to register your business name by yourself. So you don't need to go and give thousands of naira to a lawyer to register a business name for you. You can do that by yourself now. Number two, practicing license, which that you must be a registered midwife, which you already are. Number three, professional association, which is Association of General Private Nursing Practitioners. For a doctor, is Association of General Private Medical Practitioners. So for a nurse, you will need to belong to Association of General Private Medical Practitioners. Now, for how do you join this association? Yeah, each state has their offices. So you will need to locate the office of the association in your state. I will give you a phone number on the group where you can call to make an inquiry of who you can meet in your state. Secondly, authorization. Authorization is the act of picking form from Ministry of Health, which I showed you here. To pick form is 10,000 naira. I showed you here. From Ministry of Health in your state, form is 10,000 naira. See it here. For the form is 10,000 naira. Look at it. Can you see it? Registration form. Whether you want to open an hospital, you want to open what's that? So the registration form for everybody is 10,000 naira. Be it an hospital, maternity, laboratory, the registration form is 10,000 naira.
Okay.
10,000 naira, yes. So after picking the form, you will fill it. When you are filling the form, when you want to submit, please, you should understand that you are in a meeting. You should know you're in a meeting. Now, for when you want to submit, after you have filled the form, you will see the requirement. The requirement is Of course, they are not going to ask you to bring this equipment to their office, but the paper requirement is that you are going to bring a license as a midwife. So you will submit your license as a midwife. Then this waste management.
Who is sharing food that I say don't?
Then the waste management, we have to give you a certificate because we have to register with waste management. And that one is the corruption that we're talking about, because I don't really know what is their business, but we have to register with waste management. That is people that will be collecting your sharps, your needles, yes, because they want to make sure that you are not burying or burning the sharp by yourself, or you are not throwing it away in the dustbin or on the street. So you have to register with waste management. In Lagos, registration is free. Every month you'll be paying them 2,000 naira for collecting your sharps, which is fair enough. Then that is the requirement. You have to collect a letter from the local government. Okay, that one is very easy. When you put it, they'll just give you a letter. Then another thing again is what other thing? Okay, yes, for your association will give you a letter. This association, AGPMP, the professional body, they will give you a letter which you will take them, authorizing that they actually recognize you as a midwife. So is that clear? Any other question? Any other question? Any other question?
Okay. Yes, clear. Thank you very much.
All right.
Why I ask? Because they say you must work up to 10 years.
No, 5 years. It's 5 years post-qualification. Okay. Yes, it's 5 years. You must have 5 years post-qualification. If you're a midwife, you want to open the maternity home, you must be practicing for 5 years. If you're a registered nurse, you want to open a nursing home, you must be practicing for a minimum of 5 years. If you're a doctor, you want to open an hospital, you must be practicing for a minimum of 5 years. It's 5 years in all states. It's 5 years in all states. It's written in their website. Because of time, I wouldn't want us to be going about. It's written. You can see it here. You can see it. I'm coming. I'll show you. I'll show you now. It must be 5 years. It's 5 years. That's the personnel. Is 5 years. Staff. Okay. One medical practitioner in charge who serve as the operating officer. They normally put their qualification. I'm coming. Let me scroll. I'm coming. Let me scroll down.
I have a question, sir.
Go on.
Okay, sir. For example, if I'm a registered nurse, I'm a registered nurse, but I'm not practicing right now. What if I want to open a nursing home? Does it still require the 5 years practice? So I can just open the nursing home and put a registered nurse with 5 years working experience?
Yes, you can establish a nursing home and put a registered nurse. The registered nurse, wait, let me get it clearly. Let me get it clearly now. If you are the one that is going to use if you are the one that is going to use your certificate to open the nursing home or maternity, you must have 5 years. You must have 5 years post qualification. That means from the day your notification comes out, it will start counting till 5 years time. It doesn't matter who you employ. Who you employ can be using awaiting results. It can be using to whom may be concerned. But the person that owns, the person that is the operating officer, that means the person that owns the facility, must have 5 years post qualification. Or you employ someone. If you are not a nurse, if you are not a medical practitioner,
Okay.
you will, if you,
Okay.
let's assume you are an engineer or you are a banker, you have money to open a nursing home or a maternity or a laboratory. You must employ someone who has a qualification of 5 years experience.
Okay.
That person will serve as the operating officer, while you, who is the auxiliary nurse or a banker or a farmer, will be the proprietor of that business.
Okay, sir. Okay,
So
sir.
the person will be in charge of the operational activities of that hospital, while you will be in charge of the management of the hospital.
Okay, sir.
I hope you know the
sir.
difference between managing a business and running the activities of that business.
I do, sir.
Good. The person that you are going to employ is going to be in charge of the act of care of the patient,
sir.
deciding what the patient will do and what the patient will not do. While you will be in charge of who want, is there money to buy fuel, painting, and buying of stuff in the hospital, releasing money generally, running the affairs. So that's your duty, not interfering with the act of care of the patient. That is that's not your duty. So the duty is well classified. That is why when I see nurses fighting on social media that why should an auxiliary nurse open an hospital? Anybody can open any business. If I have money today, I can open a bank and employ bankers to be running the affairs of the bank, while I will be the proprietor. There are so many banks that is not owned by bankers. There are so many hospitals not owned by medical practitioners. Newgate, they have 5 branches in Lagos. None of the MDs is a medical worker. One is a computer graduate. The other one is an agriculturist. The other one is an economist. There are three directors that owns Newgate. So what are we talking about? So I hope the maternity part is clear now. The maternity part is clear now.
Yes, sir, it is.
Okay. So moving on, we're talking about nursing home. How to establish a nursing home. It's just the same thing with a maternity. Just that the difference is that in a nursing home, it's being run by a registered nurse. And in a nursing home, delivery is not allowed. Surgery is not allowed. That is just the difference between a nursing home and a maternity and an hospital. A nursing home is also known as a convalescent center. So, what are the requirement of establishing a nursing home? Business name. Your business name must be registered with the Corporate Affairs Commission. That is the #1 requirement that the Ministry of Health will ask you. Your business name, Agbabi Aka Nursing Home, is this registered with Corporate Affairs Commission? You will say no. They will kick you out of their office. You are not ready for business. Your nursing home must be registered with the Corporate Affairs Commission. #1. #2, you must have a practicing license as a registered nurse, which carries 5 years post-qualification. If you are not a nurse, that means you have to employ a registered nurse and use his or her certificate to register the nursing home. The #3 requirement is that you must belong to an association. They don't want you to kill a patient in your hospital and there you will now run to UK and go and seek asylum. So that your association will be held responsible for misconduct. That is the reason why all professional bodies must belong to association. Why do you think bike men belong to association? So that let me tell you why people belong to association. And let me tell you why government make it mandatory that all business must have association. For example, some of you have lost your car keys or your purse before in the park. Am I correct? Maybe when you were traveling, you lost your, you forgot something in a park. Where do you go to? Who do you hold responsible? I'm asking the question now.
The transport
The driver. Yes.
Yeah, but how will you find the driver? How will you find the driver?
You go to the
You go
By
to the
visiting the park.
transport company,
Now, what if
or
you
you
enter?
go to the authority.
Good. Now, what if you enter a nameless bus who does not have a name, and you enter the bus along the road? You are going to Onitsha. You now want to go and enter the bus along the road because the bus is cheap. Now, when you forgot your item in that park, who will you hold responsible? The bus does not have a name.
Yourself.
You will hold yourself
Nobody hold
responsible.
yourself
You will hold
responsible.
yourself. You will hold yourself
Yes, sir.
responsible. So, because the bus does not have a name, it's nameless, plain bus. Number two, the bus, you enter the bus on the road. Official receipt was not given to you because the bus is cheap. From Lagos to Onitsha, they told you on the path 8,000 naira. You now told your husband, oh now, I beg, these people they don't know anything. Let's go to along the road. We will see a bus going to Onitsha for 4,000 naira. Truly, you saw a bus going to Onitsha for 3,500 naira. You enter. The bus actually took you to Onitsha. The bus dropped you. Now, you now forgot your purse on the bus, and your purse contained the money that you are going to use to buy market in that Onitsha market. Who are you going to hold responsible? Who will you hold responsible in that scenario?
yourself.
You can't hold anybody. But
Nobody.
if the boss have a name, a dead line, and you enter in the park, you are sure that they have association. Now, if the bus has a name and you enter in the park, you can go to the park and request for your purse that you forgot in that vehicle. And the park will fish out the driver. Am I correct? The park will fish out the driver. If the park refuses to fish out the driver, what do you do next? What do you do next?
You go to the police station.
You arrest them, you report them.
Good. You will go to the police station. And what will the police do? The police will invite the association. Is it not so?
Network.
They will invite the association of road transport workers. Sorry, association of the National Union of Road Transport Services. Because you enter in the park and you have official receipt. The same way hospital, nursing home, maternity operates. If a patient dies in your hospital and the patient relative want to take up the job, want to take up the case with you, they can go to the Ministry of Health. And the Ministry of Health will further invite. The Ministry of Health will not invite you. Let me tell you something. Let me tell you how it's being done. When something bad happens in your facility, the Ministry of Health will not invite you. The Ministry of Health will invite your association. They will invite your association. Then your association must produce you wherever you are. They must produce you because they are the one that gave you a letter of recognition. Are you getting the step by step now?
Yes.
If your association cannot produce you, your association will now write to your professional body. If you are a doctor, they will write to MDCN to stop your license, to terminate or to retrieve or to withdraw your license until you are produced.
Who are those making this noise now?
Until you are produced. So your association will write to you will write to your professional body. If you are a doctor, they will write to Medical and Dental Council of Nigeria that they should withdraw your license. Maybe you are hiding in one village and you are now practicing as a doctor. Maybe you are hiding in a village where there is no network. You are now practicing as a doctor. Now, you know that as a doctor, you have to renew your license every year. You have to renew your license every year. When you now go to renew your license, you will now find out that they have been looking for you. Then they will just grab you like this and say, we have been looking for you since last year. Where have you been? Now we have finally caught you. Because they are going to put an embargo on your license on their website that this person is wanted. The same way as a nurse, if you commit a crime in your facility, in your maternity home or in your nursing home, and you run away or you run away to UK, maybe you are going to renew your license in that UK that you run to. Yeah, that is why you see all these UK nurses. They will call people that are in Nigeria. Please, I'm looking for someone to help me renew your license. If you have committed a crime in Manchester, in UK, you now run away and go and seek an asylum in USA. Maybe you will renew your license. When you now want to renew your license, and the UK Association has written to Nigeria Association, that Nigeria professional body, that so nurse, Agbabi Akarut, we are looking for her. Adesuwa Glory, we are looking for her. She has committed a crime. When you don't want to renew your license, when the Nigeria NMCN is searching your name, they will now find out that your name has been blocked. That means you are wanted by a professional body. You have committed a crime. By then, they will now have to invite you. And you will just go to the office. Police will just hold your hand like this. So many nurses are in prison. You will not know. Because they don't want their name to spread. So many doctors too. Have you not heard of doctors in prison, going to prison, being sued? Do you think you can run? You cannot run. As a professional, you cannot run. Even, listen, if you renew your license in Nigeria as a professional, you cannot run. Bankers, you renew their license. Doctors, nurses, I don't know. I know that bankers renew that. You cannot run. So you have to be careful. I hope this, we are talking about hospital, maternity, and nursing home. I hope these three are clear. Are they clear? These three are clear. And hospital, maternity, and nursing home, they are clear, right?
Yes.
Does anybody have a question? Ruth, go on, ask your question.
Okay. Sorry to take you back. Like yesterday, you mentioned the cost. That
okay.
If we have like 700,000, we can open a maternity home.
Yes. I
And
mentioned
the about the requirements is that the same opening a hospital. I want to know, how did this 700,000 fit into all those? Although I did not join early anyway,
okay.
But I want to know how I can utilize that my 700,000 to open a maternity home.
All right, we are running out of time again. They have given us 10 minutes again. We are going to. I'm recording this session, so if you missed any point, you can go to our YouTube page and watch it. I'm recording it. So I have recorded the first one. This one now that I am recording now, we are running out of time. So if you missed it, you can always go to our YouTube page to watch it. You understand? Okay. So now let's calculate. I told you, I said, if you have 700,000 naira, you can open a nursing home. I started my hospital with 500,000 naira. That is 2017. That was when Nigeria was still better. But now things are expensive. So let's calculate. Let me bring out my calculator. Let's calculate. I hope you are with pen here. If we log out, please don't panic. You can log in again almost immediately the way we did it before. All right. So I appreciate your understanding. So let's calculate how we got
Are you talking to me?
that 700,000 naira. Let's calculate how we got that 700,000 naira. Okay. Hold on, please. Hold on, please. Let's calculate. Trying to open a Microsoft Word so that we can all calculate it together. So you have to be patient with the way this thing is loading. Look as if it does not written well. I didn't want to use a Microsoft Word. I didn't want to use a PowerPoint. I wanted to use a Microsoft Word. All right, so now let's calculate. Let's calculate. This is a practical session. If you miss it, you might not understand what we are doing. So you need to pay attention to what I want to do now. Pay attention to what I want to do now. It's very important to pay attention. Pay attention to what I'm doing now. Now, if you want to open an hospital, a maternity home or an hospital or a nursing home, what is the first? Can you see my screen? Can you see my screen?
Yes, we can see.
The first thing you need to do is location. The first thing you need to do is what? You have to decide the location. The location. Which location do you want your hospital to be? That is the most difficult question I have ever been asked. Which location? An hospital must be situated in a serene environment. So, location. You have to decide the location you want to do. And the location you must make sure that it's a residential area.